Hall of Fame, yeah.
I'd like to call this Greenville County Council Communications Governmental Affairs Committee meeting to order. And Councilor Bradley, will you give us an invocation?
Yes, sir. Thank you. Let us pray. I thank you, O Lord, for this day, for this rain you sent. Pray, Lord, you be with us. We go through this meeting, that you give us the wisdom, Lord, to move it forward. Thank you for who you are and what you do for us. In Christ's name I do pray. Amen.
Amen. And next on the agenda is the approval of the minutes. May I get a motion?
To approve the minutes.
All in favor say aye.
Aye.
Motion passes. And next up, we have a presentation from the Phoenix Center about the Greenville County Commission on Alcohol, Drug, and Drug Abuse. Come on up.
Good evening, council members. Thank you so much for giving us the opportunity to come speak with you guys tonight. I know when we were presenting on SCORE, there were some questions about, prevention in our community because there's so much focus on treatment, so we're really excited to share this information with you. I did want to point out a few people we have here with us today. So we have our CEO, Becky Maddox, out here, and we have several of our commission members here with us that you guys appointed. So thank you so much for carefully considering their applications and putting people on our board who truly care about our mission and help us do this very important work. So I'm Jessica Owens. I'm the Chief Operating Officer here at the Phoenix Center, and this is Amanda Davis, and she is the Director of Prevention and Community-Based Services. And we'll jump into the presentation. So we won't bore you with a ton of history, but this might be something you've never heard before. So just a little bit about how we came to be. So it started back in 1968, where the Commission on Alcoholism was created and recognized as the official governmental agency on alcoholism in the county. And then in 1971, it changed to the Commission on Drug Abuse Control. And then in 1973, JCADA was formed, and this came from the Act 301. So a lot of times you may hear us say, hey, we're part of the 301 system. And that just means that there is a designated authority on alcohol and drug abuse in each county here in South Carolina, and we're one of those. And then in 2004, we began doing business as the Phoenix Center. And one of the reasons for that is just because of stigma that sometimes comes with substance use, so the Phoenix Center was just a more welcoming name. So how do we serve our community? So our vision is inspiring hope, promoting health, and strengthening communities. And our mission is serving and loving our community by nurturing safety, developing trust, offering choices, engaging partners, and empowering families. And how we do this, a lot of this has to do with trauma-informed care. So we are a trauma-informed care agency, and one thing we'd like people to know is about 95% of folks who come through our services have a history of trauma, and we are trying not to re-traumatize people. So that's very important to us. We always provide quality services to people, regardless of their race, gender identity, sexual orientation, ethnicity, religion, or their ability to pay. So we serve anybody, even if they can't bring us $1 through the door. And part of that is because of you guys supporting us and giving us funding each year, which we so appreciate. And then we talked about how there is a commission like us in each county. So we are the largest single county provider in South Carolina. And so we offer a broad continuum of services, and that goes from prevention to adult and adolescent outpatient, all the way up to our withdrawal management and women's residential program that you may have heard referred to as Serenity Village. And now I will pass it to Amanda, and I'll come back up at the end to see what questions you may have.
Hey everyone, thank you so much for allowing us to be here and share a little bit about some of the services that we do. So I'm here to talk obviously about prevention and what we do in the community here in Greenville. So our goal in prevention at the Phoenix Center is to prevent, delay, reduce. Obviously, prevent substance use from happening, delay if someone is studies show that when we can delay use or onset of use from like 18 or below, they have a significant decrease in substance use issues or misuse over time in their adult life. So that's very important. And then reduce. So if they are currently using, how can we reduce so they can make healthier choices? have reduced health effects, things like that. And so we're committed to helping Greenville County residents of all ages avoid the dangers of using alcohol, tobacco, and other drugs. And I'll talk about the different services that we provide in our department. But one thing I kind of wanted to touch on is about our staff, our prevention staff at the Phoenix Center. We are all certified prevention specialists or in process to be certified. And so we have in process certified prevention specialists and senior certified prevention specialists. We are a staff of 5 people, so we are a little bit small, but we do amazing work in the county, and you'll kind of see the numbers that we produce at the end. Our certification is through ICNRC, or the International Certification and Reciprocity Consortium, and they use a competency-based approach, which helps achieve a standard of professional education and experience to provide quality substance abuse prevention services. And so what that means for our staff is that they are, in order to become certified from the beginning, they are required to have 2,000 hours, clocked hours within 5 years. They also need to have 150 training hours within 3 years that are specific to our CSAP strategies, which we have 6 different strategies that we use, and domain. So education, information dissemination, environmental strategies. So we have a whole bunch. I won't bore you with it. And then also 120 hours of mentored hours. So they have to find someone else who is already certified in the state who can help mentor them in the capacity to become a better prevention specialist. Then they are required to take a written exam and an oral exam. They are also recertified every 2 years. So starting off with some of our programs, we have a mobile substance use education unit. Some of you may have seen it in the community. This was unveiled in 2021 and is a partnership between the Phoenix Center and the coroner's office. And it is a 42-foot trailer that we bring around everywhere in the county, sometimes out of the county if it's requested. And this is very hands-on. The goal of this is to provide education in areas that may not have the resources or the education or be able to come to places where we might have prevention services or learn about substance use education and prevention. And so we bring this to the community. Since its unveiling, we have reached, just with this trailer, well over 30,000 people in the community. And it was unveiled kind of during a hard time. So I feel like that's a win because it was during COVID times. But outside of the trailer, we have hands-on activities. You can see from the pictures, a lot of impairment goggles. We have different levels for alcohol impairment. We have opioid impairment goggles. You can see one of the carts that we have, and that's someone from the coroner's office giving it a test drive. And then inside we have resources for the community where we also have resources from different agencies. So that way it is really for everyone. No matter what kind of resource they need, they should be able to find it on the unit. And then we also have TVs that share educational videos. We kind of tailor them for the group that we're seeing. So if we see elementary school, we will have a video just for them. If we see high school, we actually have a video that our high school interns made at one point. So it's peer education, which is really nice. And then we have a recovery story on there as well. Next up, we have YTRI. So YTRI is our evidence-based curriculum that we use. It is a 10-session curriculum, and this is strictly like resilience building. So although it doesn't focus strictly on alcohol and other drugs, it does build up resilience and decision-making skills, and this is for at-risk youth in our community, anywhere from kindergarten to high school. We tailor it for the group that we're seeing. We have been very grateful to partner with the school district for to go into different schools for YTRI. We've gone to every alternative school, and then multiple middle and high schools around the county. We also have the Greenville County Youth Board. So this is for rising 9th through 12th grade Greenville County students. And the goal for the Youth Board is to serve the community through peer-to-peer education, awareness events, and alternative activities. So they have planned a youth conference for alcohol, where they partnered with the Pickens County Youth Board, and they had students from both counties participate and kind of come to this all-day conference. They do a lot of social media campaigns. They just recently built a team for the NAMI Walk, if you're familiar with NAMI. So they do great work in the community starting in high school. So we appreciate them and all that they do for us. And then, of course, we have PREP, which is our Palmetto Retailer Education Program. This is merchant education. And so this is for businesses and employees that are selling alcohol and tobacco products on and off premise. This is a DEOTIS-approved curriculum, and we educate on state and local laws and policies surrounding alcohol sales to help reduce underage access to alcohol and tobacco. We discuss when to stop serving for on-premise, so over-service, and what that looks like and the laws that go around over-service. We talk about placement for our off-premise locations, like where are your products placed and what youth can see and what they don't see, and just everything surrounding that. It's a 4-hour curriculum, and we have recently had a lot of proactive PrEP participants come through, and we've reached over 200 servers or individuals selling alcohol in the last year. We also have a tobacco education program, which is SC STEP. This is also a DEOTIS-approved curriculum, and it's designed to educate youth on risks associated with tobacco and nicotine. Our referral sources for this are schools, SROs, parents. It can be self-referred. We have had a few students self-refer. And although it's called Tobacco Education Program, we very much talk about vaping. And so that is the method that is focused on the most is vaping nicotine products. We also have a section, if requested, for marijuana, just for the education part of that. We do a lot of media campaigns in the county. We use geofencing, billboards, radio, social media boosts, and print publications. These are just a few of the billboards and kind of geofencing ads that we have had. If you're not familiar with geofencing, it's the targeted ads on your phone. So when you go into a store, they can just kind of, if you go in that store, it's usually about 3 days that you possibly could see one of our ads. And then billboards, obviously we all know what that is. We have had great success with radio, partnering with the Roar in Clemson and also Summit Media, so local stations. And with our media campaigns, every year we usually gain over 1.5 million impressions for people who can see our ads and get education on different substances as well as support resources and things like that. We also have the alcohol enforcement team at the Phoenix Center. We are the lead county authority for the 13th Circuit, so Pickens and Greenville. And this is a team of law enforcement officers, so we partner with every municipality, both in Greenville and Pickens, and we focus on environmental strategies. So that's compliance checks, party dispersals, shoulder taps, things like that. And really our largest number from this is compliance checks, and the goal of the compliance checks is that they are done monthly to ensure that we are maintaining a buy rate in the county of below 10%. And we kind of have the buy rate at the end too, but I'll kind of talk a little bit about that. We did see an increase in a buy rate during COVID, and then we have slowly started seeing it come back down. So we are really pleased with that, and we only hope that that will continue to decrease. And this is both, even though this is alcohol, we also do compliance checks for tobacco as well, so checking the vape stores. We have 2 coalitions out of the Phoenix Center. We have EUDL, which is Enforcing Underage Drinking Laws. This has been in existence for over 20 years, and our biggest partner is the AET, so Alcohol Enforcement Team. This is the meeting that they attend monthly where we can share information and gain knowledge about different issues happening in the county. And then we also have ECHO RX, which is Empowering Communities for Healthy Outcomes. This coalition has been in existence for over 10 years now, and we have over 40 different community partners who are dedicated to looking at solutions regarding opioid misuse and abuse in our county. So we have increased drop boxes, decreased the number of prescriptions that have been written in the county, and we Also have seen a decrease in our overdose deaths in the county, and the work from that coalition has definitely contributed to that as well. We do a lot of medication safety and disposal. So far in fiscal year 25, we have distributed 208 lock boxes and 1,983 medication disposal pouches. So you can see there 2 of our staff members at one of our events with resources, and then we have lock boxes that are provided on the side. These lock boxes are amazing for anyone who has medication that they need to keep locked up if they're traveling, if they live at home with young children, or if they just have a lot of medication that maybe they have a roommate and they don't want someone to get into their medication. This fits about 7 different prescription bottles, depending on the size, and they can keep them locked safely in there. This definitely helps with people accidentally overdosing, especially young children. And then we also have our medication disposal pouches. So we have 2 different kinds right now. We have doTERRA, which is like a little bag, and people can put their medication in there, add water, shake it, and throw it in the trash. And then we also have DisposeRx, which looks like a water enhancer pouch. So we try to always make sure people know not to put that in their water. But they put it in the pill bottle, add water, shake it up, and then they can throw it out. So definitely helps with not putting pills down the toilet and flushing them, and also making sure that people don't get medication that they don't need. So a little bit about our reach. You can see our compliance checks, and this is for this is for the year of 2024. So January to December. We did 874 compliance checks. High visibility enforcement is very specific social media around high times of the year that we see more enforcement happening. So 4th of July, Memorial Day, Labor Day, spring break. So definitely where we want more education to kind of like be out. So we do a lot more social media posts, maybe targeted billboards and geofencing. And so our impressions for that were almost 3,500. In the community, we reached 9,332. Our school district, a little over 7,000, 28 for TEP, 262 for PrEP, and then YTRI was 526. And then how this has impacted our community, the implementation of various community surveys, which provide valuable community level data, has helped us target our programs specific for Greenville County. So we have a young adult survey that we do every other year. We will actually be doing that one this year, and that is for ages 18 to 25, and it is for the whole county and what they see happening, their use or perceived use. We also have a community survey that goes out every other year, and then we partner with the different schools that have YTRI to do a survey for YTRI as well, which helps us determine if YTRI is working for the students or if we need to change our program. Right now, it has shown a great decrease or maintaining no use. We've remained at 10% or below for alcohol buy rate in Greenville County. From 2017 to 2022, there was a 36% decrease in impaired driving crashes for drivers 21 and younger. From 2022 to 2023, we saw an increase in hospital visits, but a decrease in visits related to alcohol for ages 0 to 20. We had a 25% decrease in overdose deaths from 2022 to 2023. And in 2023, we distributed 1,269 doses of naloxone. And we have a 6% tobacco buy rate in fiscal year 2024 for Greenville, which is amazing. And then that is all that we have. Do you guys have any questions?
Counselors, you got anything? Ms.
Yeah,
Seaman?
just really, thank you so much for the great information. It's amazing how much you can do with just 5 staff members. So really hats off to you. Will you talk a little bit more about the buy rate? Is that self-reported, or how are we calculating buy rate?
So the buy rate is reported by the officers that go out and do the compliance checks.
Gotcha.
Yep. So when they go out, they will fill out some paperwork for us for every buy that they conduct, or even not a buy, every time they try to go out. So let's say the sheriff's office goes out and they do 50 compliance checks. They will fill out 50 different forms. And from there, they will say, yes, we had a buy. No, we didn't have a buy.
Gotcha. Thank you.
Awesome. Counselor Bradley, you got anything?
I'm not, the recovery part from our church, we take part in the sub-rate recovery, Serenity House, is that how you say, is that correct?
Serenity Village, yes, sir.
Yes, and then the men of the heart, I've forgotten what it's called. Yeah, so all this was great information, because the front end I don't see, we usually on the back end when it's recovery, so this was insightful for me to see. So I'll take this back to my home church, especially to the CR leaders, and they probably already know, but
Thank you. We appreciate that.
thank you for coming.
And I don't have a question for y'all. I just want to say thank you once again. And this is a little near and dear to my heart. I've had 2 friends die of overdoses, and I miss them every day. So y'all getting out there in the community and doing whatever you can, and seems like the numbers that you're presenting sounds like y'all are pretty effective. So I just want to say thank you. I really appreciate y'all. Y'all are doing a great service.
Thank you. We really appreciate you letting us come out here and speak.
Absolutely.
If I knew you was around in '99 when I quit smoking, I could have used the help. I have to ask my wife and my family, yeah.
I will say one thing we didn't touch on in the presentation is some of our risk reduction or harm reduction strategies that we use. And one is going out and doing presentations on opioids, specifically with Narcan. So we go out in the community and do those. So if you know of an organization that would like free Narcan and education on what overdose looks like, we are happy to do those.
Awesome.
Okay.
Oh, and I guess I do have a question. Have y'all made it out to every single public school in the county yet?
We have made it out to quite a few. I wouldn't say every single one. The mobile unit stays pretty booked and busy,
Yeah.
especially at the schools. Those are very popular places for the mobile unit to be. We have gone up north to the northern part of Greenville and all the way to Fountain Inn. There are 76 schools in the county, I believe, with elementary all the way to high school, right? I think it's around 70
Yeah.
something. So I'm sure we're missing some, but we have definitely gone to, I would say, at least half.
Gotcha. Do y'all have like a specific way you like target schools, or is it just kind of like they reach out to you and then you just say, sure, we'll show up?
So for Y-Try, we do target based on our data for the survey data that we receive, which getting it out to the community is probably the biggest, not barrier, but yeah, barrier is probably the best word, just because our county is so large, and making sure everyone has access to the survey, whether it's through social media or flyers, or for one of our surveys, we actually did targeted mail postcards, which was interesting. If you have not worked to try to like do some of that targeting messaging, it almost felt like we were sending out, those little like coupon books you get. But it actually was very effective, especially targeting people that we thought maybe are not on social media. But we use that data to kind of target what schools maybe need more,
Right.
like
High
resilience
probability
building.
area type. Yeah, that makes sense.
And then for the mobile unit, we do the same, but it is pretty steady. So the mobile unit, a lot of times the schools will just find a flyer. We speak at the counselors meeting that they have before school starts and pass out the flyers, and then principals meetings, and we'll give them the flyer as well. So the unit is booked through kind of word of mouth.
Very cool. All right. Well, thank you so much.
Thank you.
Thank you.
And that concludes our presentation. And so may I get one final motion?
Motion to adjourn.
All in favor, say aye. Aye. We are adjourned.